Hi guys, welcome back to lesson 2. Today we're going to be talking about oral health instructions and just going over some daily tips for cleaning your teeth.
So first off, thank you so much for participating in our research model. The purpose of this research model is to study the association between dialysis treatment and oral health. All of the information collected from the surveys will remain confidential. The program will consist of 4 virtual lesson plans and 2 surveys per lesson. One before the lesson is delivered and one after. While personal information, such as your name or address, will not be collected, the surveys may include questions regarding demographics. The surveys will be collected from a third party once completed to further ensure that your identity remains anonymous. Participation in this study model is completely voluntary, and the participant may withdraw at any time. Your completion of the survey will be considered your consent to use the information provided for our research model. Thank you.
So for today's objectives, at the end of the lesson plan today, you should be able to state how long you should brush your teeth. You should be able to identify the correct amount of toothpaste to use when brushing. You should be able to recognize the different options for cleaning between your teeth. You should be able to name the alternative cleaning methods to toothbrushing. You should be able to describe the proper technique for tongue cleaning and also understand the importance of cleaning dentures daily. First up, we're going to talk about toothbrushing. It's something everybody should be doing at least once or twice daily. You should definitely recommend that you do it in the morning when you wake up and at night before you go to bed. There are 2 different types of brushes. Primarily, there is the manual toothbrush, or the one that you use at, just a regular old toothbrush, and then there's the automatic toothbrush or the electronic version. You're going to use these brushes, like I said, 1 or 2 times daily, and you should be brushing your teeth for a continuous 2 minutes for each time you brush. And we're also going to talk about how much toothpaste you should use, and it'll be demonstrated in the first video, but it's going to be a pea-sized amount. You don't want to go any more than that.
Hi, so before we actually start teaching you the technique for toothbrushing, we want to go ahead and just review how much toothpaste you should be using when you're brushing. Okay, so I know a lot of commercials like to show a lot of toothpaste basically covering the whole brush portion of your toothbrush. However, that's a misconception. You do not need that much toothpaste, okay? You really only need a small pea-sized amount. All right, so I'm going to show you here how much you need. And that right there, if you can see, is a small pea-sized amount, and that is sufficient to clean your teeth very well. All right, so next we're going to go ahead and move on to the technique for brushing. Okay, so the first toothbrushing technique that we're going to discuss is with using a manual toothbrush. This is what we call a manual toothbrush. It's just a regular toothbrush. It's not electronic. You have to do the movements yourself with your hand to get it to work, okay? That's really the only difference between a manual and a mechanical toothbrush, which we'll show you later on. So we have this toothbrush here, and I'm going to use my little friend here, okay? This is just a set of fake teeth. We have the gums, and we have the top arch and the bottom arch of teeth, okay? So one thing that you really want to do is take your time when you're brushing. Like we mentioned before, it should take you about 2 minutes. All right, so that is about a minute on the top and about a minute on the bottom. And you really want to make sure that you are getting all the surfaces of your teeth so that you can remove as much bacteria as possible. So the technique that we tend to see a lot in clinic with patients is this. They like to do big circles all the way across. And as you can see with that technique, the thing is that you're missing a lot of spots. Now, You really want to take your time. You really want to make your movements very small and gentle so that you don't miss spots. One thing that we really recommend when you're brushing is that you point the bristles of your brush towards your gums. All right, because up here in your gums, you have tiny little pockets that trap bacteria. So you really want to disrupt that bacteria. All right, so you want to just point it a little bit towards your gum as we're doing here. And you want to do circular movements, but very small circular movements. Really trying to make them overlapping strokes, okay? You don't want to move too fast, just very overlapping. And then you can also just go back and actually brush down the teeth. But you want to do small strokes all the way across. And you want to make sure that you're getting all the way across on the top, what we call the facial side, which is the side that you can see, and what we call the lingual side, which is this side, the side pointing towards your tongue. All right, the top and the bottom. This is what we call the lingual side right here. You want to make sure you don't miss that surface. All right, so you want to go back when you're brushing. Try to get as much of the back of your molars as possible. And the same thing, you want to do circular movements pointing towards to your gums all the way across. All right. So right here we would have a tongue. All right. If this was a real mouth, there would be a tongue right here. Right down here, you'll have these two little, like what we call glands. So a lot of your saliva comes out from right here. That's why you get a lot of tartar buildup in this area. So you really want to make sure that when you're brushing, you do not miss that spot right there. That area is very important to get. When we're cleaning patients in clinic, we tend to see a lot of tartar right in this area. All right, so you really want to make sure that one of the things that you do when you're brushing this bottom arch is really get to the lingual, like we said, the lingual side towards your tongue, that back side of your teeth, pointing the bristles or the brush down towards your gum, and really just brushing that area very well to disrupt a lot of that bacteria, okay? So, once again, just making sure that you're getting all the surfaces of your teeth, the back sides, make sure not to miss the back sides, and not to miss this area right here, which is very important, okay? The one right there. All right. Okay, so the next technique we're going to go over is still toothbrushing, but now we're using a mechanical toothbrush. All right, so remember, last time we used a manual. This is a manual. All right, plain toothbrush. This is a mechanical or electric toothbrush. So the difference between this and this is that with this brush, you really don't have to do much of the movement yourself with your hand. Okay, so this is perfect for someone who might not have a lot of movement on their hand. Maybe if you have like arthritis, if you just can't grip, onto small stuff very much. This is perfect. It has a pretty wide handle so that it makes it easier to grip. You don't have to use a lot of energy with it. All you have to do is basically just hold it in place while this does the work for you. All right, so I'm gonna go ahead and show you. It has a little on button right here. And you can probably hear that noise. That means that it's on, okay? So with this, like I mentioned, you don't have to do much of the work yourself. All right, so I'm just holding it in place. And the brush is actually vibrating so fast, all right, that it's knocking off all of that bacteria, and it's doing those tiny circular movements so tiny and so fast that I can't even really keep up with it with my eyes, okay? Just know that it's doing those tiny circular movements on its own without you having to do it. All I have to do, like I said, is just hold it in place, and my only job is to kind of just move it slowly across the arch. But I do not have to do this. I don't have to go back and forth. I just slide it across the arch while the brush itself moves and takes off all the bacteria. Alright, and like we said before, you want to get the side that you can see, you want to get the side in the back, top, and bottom. When I get to the bottom, all I have to do is hold my toothbrush there and just move it from tooth to tooth. I don't have to do any of the movement myself. So this is a brush that we would really recommend. Like I said, if you're someone who has a lot of trouble, maybe your hand gets cramped when you're holding it too tight, you can't do a lot of this, this is perfect for you if that is your case, okay?
So sometimes we understand that it is not feasible for us to brush our teeth. There might be difficulty doing so. You may not be physically able to, have the dexterity to, do the motions that you need in order to brush your teeth. You may have infection in an area when you brush and that causes you pain, or you might have, a whole mouth infection, which is a whole different situation, where your gums are inflamed and it's very difficult to brush your teeth without having pain or sensitivity. In this case, we do want to use something in order to get that debris off, that leftover food stuff and that plaque, so it doesn't build up. So in the next video, we're going to demonstrate a wet gauze that you just wrap around your finger, with some water, or you could even do Listerine or some type of mouthwash, and you just take it and wipe away the debris off of your teeth. And you can also use alcohol-free mouth rinses if you're having that kind of pain and sensitivity. As an alternative, we can use a piece of gauze, 4x4, 2x4, anything like that, that you can get at the drugstore or your grocery store. Looks a little bit like this. And you're going to use that to clean your mouth instead of a toothbrush. This is a little bit less abrasive and still gets the job done. So basically what you're going to do is you're going to take your 4x4, you're going to wrap it around your pointer finger like this. You're going to dip it in clean water. And at that point, you're just going to take it from one side to the next in slow rotating motions all the way around. Make sure that you're going on the tongue side as well. And I can show you on Bob here. He's got a kind of jacked up mouth, but you're just going to do slow rotating motions all over the surface of your teeth. And then do the same thing on the tongue side. So going all the way around. And on the bottom and the top. You should see some of that debris come off on the gauze piece.
So now that we've gone over how to brush, we're going to go ahead and talk about how to clean between your teeth. Alright, so as we talked about before, it's very important to clean between your teeth to be able to remove that bacteria that is just sitting nice and snug in your gums, okay? This is what's going to help prevent a lot of diseases. So we can do this in different ways. We can use string floss, which is what the majority of people use. We can use floss picks, which we're also going to talk about. And we can use water flossers, and we can use interdental brush. So usually your string floss and your floss picks are something that you're going to use when you have nice and tight gums and your teeth are kind of touching. When you have spacing between your teeth, string floss or floss picks might not help very much, so a water flosser will be your best choice, or an interdental brush. An interdental brush is basically like a tiny little brush that you're just going to use to kind of slowly move back and forth in between your teeth to clean the surfaces. All right, so let's go ahead and check each one out. All right, so here we see a picture of a floss pick. All right, a floss pick is basically a string floss, but you just have a small piece of floss in between these little two plastic holders. These are great to carry with you or to help like remove things that once you get like food stuck in certain areas. Those are great for that. If you are someone who might not be able to use the string floss just because you're not able to move your hands correctly or anything like that, the floss pick are pretty helpful. You want to make sure that you're using these, ideally you want to use them daily, but at least 3 to 4 times per week so that you can keep that area very nice and clean between your teeth.
The next demonstration is for string floss, and as you all probably know, there is a wide variety of different brands of string floss out there. Today I have Oral-B with me, but my favorite is probably Colgate. And honestly, when it comes to string floss, it doesn't really matter. Usually, you know, as long as they're the same size. We do have a few different products. We have the regular string floss, and then we have the super floss, also by Oral-B, and I'll show you what that is later. But generally, string floss is all the same size. Some of them come with mint flavor, others are wax coated, not wax coated, and it really just depends on your preference, but they all pretty much do the same thing. So first off, you're going to take your floss, and I usually get, you know, for me, probably about 2 feet, about that long. Doesn't have to be too long, but we want it to be long enough to where we can switch the floss that we use in between each tooth, and I'll show you what I mean by that. But for me, I'm going to be wrapping each side on my pointer finger. So I'm taking the end and I'm going to take it in between my thumb and my pointer finger, and I'm just wrapping it around my pointer finger. And you're going to do this on each end, and you want to get pretty much the same length on either side. Wrap it around your pointer finger. And just come to a connection point. So it should look like this. All right, when we've gotten here, I usually like to start at the bottom. So I'm going to take my pointer fingers, I'm going to go inside. And what I did there is I cheated. I didn't go all the way back to the back tooth. But I wanted to just show you that you're going to take it with your pointer finger. You're going to use your middle fingers to push down, because you want to push down. And when we move to the top part, you're going to use your thumbs to push up. So middle fingers down, thumbs up. And what you're going to do is you don't want to force the floss down in. You want to use a seesaw motion in between your teeth, and once you get down in there, you're going to go all the way down just a little bit below the gums, and then you're going to create a C-shape motion. So you really want to bend that floss because you want to go on the back side and the front side. It should wrap around the entire tooth. So once again, taking this, I'm going down to the bottom, and I'll show you on a front tooth so it's a little bit easier to see. Seesaw in, cup, and cup. Just like that. So down, seesaw in, cup on one side, and you want to go up and down, cup on the other side, up and down, and that's how you're going to get that stuff off. And then on the top, we're using our thumbs. Cut and cut. Easy enough? Something that we aren't going to demonstrate, but because these are out there on the market, we do want to mention these. These are called end tuft brushes. I haven't seen a lot of people use these, but they're good for spaces that a lot of people can't reach, like the back of your molars. They're also good in between your teeth, but it basically looks like a toothbrush, except instead of there being bristles in a larger area around the head of the toothbrush, they're just in a small section, and it's a tuft of bristles. So this allows you to maneuver in those tight areas, those hard to reach spots. So that's just another option for you that you can purchase out there. Another option out there, one that I do recommend, is called a proxabrush. And these are really, really good if you have spacing in between your teeth. So a lot of people have gaps in between your teeth. Well, when that happens, floss is not going to help you. It's not going to do the job that it's supposed to do. It can clean in between your teeth, but we have crevices based on the anatomy of your tooth, where your floss, it's just going to go right over it. It's not going to get in those crevices. So these proxy brushes are a really good substitute for regular floss. The brand over on the left here is called Gum, G-U-M, and they have different levels of proxy brush, which is really convenient because not everybody has the same space in between their teeth. So if you can see, the handles are the same, just different color, but the brushes themselves increase in size as you go down. And on the far right, you can really see what type of spacing you have. And what's great is these pictures are on the packages when you buy them. So you can see, you know, what exactly they're meant for. But you have ultra thin going down to tight, and you can start to see a little bit of spacing in there. And then you have moderate, where you can really start to see that spacing, and going down to wide. And we're going to show you in the next video what it would actually look like in between teeth. But again, these are really, really good for spacing in between your teeth. They're going to go into those crevices where floss cannot reach. These are really good for removing stain in between your teeth, because floss is not going to get that off. So these are really good. You do not need to use toothpaste with these. Conveniently, these can go with you throughout the day, and you can use these. I wouldn't say you could use these instead of floss. Use these in areas where you have that spacing, but it's really good to have something to clean in between your teeth regardless. So this right here is the proxy brush, and this is what it looks like in the packaging when you get it at the store. And what's really cool is on the packaging it says at the top what it's meant for. So this brush is the pink brush, and it's meant for the moderate size, and actually all of the gum products should have this on the back, where it demonstrates, you know, which different products are best for you based on color. This is a moderate proxy brush, and I have Bob that has come back to help us out in demonstrating this. They all come with a cap, so you just take the cap off. You have the brush right here, fine grip. You take Bob, and he's definitely got some spacing in between his teeth. So you're going to take the proxy brush, you're just going to go right in between, in and out. You can do this a couple times, but you don't have to repeatedly keep doing it. And you're just going to go in all of the spaces that you can. Not everybody has the same spacing in between all of their teeth. So like, as you can see, this tooth right here has a little bit more spacing than, let's say, this tooth. So I wouldn't recommend using a ultra brush, you know, one of the biggest brushes in between all of your teeth, because all you're going to do is damage the gums that aren't already damaged. So just be careful and use the brush where it needs to go, and then other areas you can use regular floss or whatever else is convenient for you. But yep, and you can do the bottom as well. And you're just going to go in between. Do not force the brush into the spaces. It should easily glide through. If you're forcing it, then either the brush is too big or you're going in too far. If you notice that each brush is tapered, so it starts out small at the top and then it should go wider at the bottom. You do not need to push the brush all the way through. If you find that push the brush halfway and you start to get resistance, then stop, and you should be good with that. The last thing we have for you today as far as cleaning in between your teeth is called a water flosser. This is by the brand Water Pick. This is usually the one that we recommend. But with any standard water pick like this, you're going to have the reservoir top right here. And you usually just fill that up with clean water, or you can cut it with water and mouthwash, 50-50. But all of them come with the standard attachment, the standard tubing here, and this is connected to the reservoir. So when you turn it on, the water or whatever you put in the reservoir is going to flow through this tube. And each of them have a handle and different detachable tips. So most of them come with the standard tip, and this is just a tapered clear tip that's tapered on the end. This is really good for getting in between your teeth. And then a lot of the other versions, they have different tips for, let's say, implants and bridges and everything else like that. But these are really, really good for people who don't like to floss normally. These are just as good as regular floss, but basically it pushes a steady stream of water through your teeth, and that pushes the bacteria. It's firm enough to push that water through your teeth, push the bacteria through, and it creates a clean environment with you having to do less manual labor. The problem is it creates a lot of water, so we do recommend that you use this over a sink, or you can even implement it in your shower routine. So a lot of these are cordless, and you can just put them right in your shower. These are great. I'll show you how to use it now on Bob. But basically, Bob's got a lot of space in between his teeth. So you're going to take the tip, and you're going to point it right inside the gums. You're going to put it right at the gums, and you're just spraying it. It should have a consistent spray, but you're going to go in between the gums, and you're going to round it out. And you see how Bob here has some roots exposed. So he's a perfect candidate for this. He can just spray some water right in between those roots and get all that bacteria out, because all the other appliances are not going to work for him. And you're just going to do the same thing for all of the top, the bottom, and on the tongue side as well. And you're really just making sure that you are spraying right in those gums. And you're just going to put the tip right in between there. Yep.
All right, so another thing that we need to talk about that a lot of people are not aware of is that you need to clean your tongue. All right, so tongue cleaning is very important. A lot of people don't realize that your tongue holds a lot of the bacteria that can cause that bad breath. All right, so part of your cleaning your mouth is not only brushing your teeth, but your tongue. You can always do this with your brush. So you can, if you just want to go ahead and brush your tongue with your brush while you're in there brushing your teeth, you're welcome to do that. However, they also have specialized tongue cleaners, all right? So these can be found basically at any store, Walmart, drugstores, any grocery store pretty much. wherever they have toothbrushes, they usually have the tongue cleaners right there with them. All right, so this is an example of a tongue cleaner. All right, so on one side, it's pretty bland and flat. On the other side, this part right here is the part that does the cleaning. All right, so basically what you're gonna do with this, when you're using the tongue cleaner, you want to go ahead and place the tongue cleaner as far back as you can in your tongue. All right, so you don't want to make yourself gag or anything like that, or make yourself sick, but you want to get pretty far back there, and then basically just slowly, you know, doing overlapping strokes and kind of like scraping your tongue. In this section, you're going to start to see a lot of gunk, maybe like a brownish color, just kind of like start piling up on there. You want to go ahead and shake it off in the sink and rinse this thing very well, and then go back in there. All right, so you can do that a couple of times, or until you start seeing more of a clear saliva that starts coming off of your tongue. If you keep getting like a brown saliva that keeps coming off, you want to keep going back in there. All right, so the position you're going to use is this. You're going to stick out your tongue and place that tongue cleaner as far back as you can and just scrape, all right, all the way to the tip of your tongue. Like I said, right in that area, you're going to start to get a lot of like brown saliva, and you want to rinse that off before you go back into your mouth with it, okay? So once again, this is a very, very important thing to do, because your tongue holds so much debris and so much bacteria. So very important. So many of you may have what we call dentures, which are basically teeth that are made out of plastic and are removable. So you want to make sure that every day you're not only cleaning your own teeth, but that if you have dentures, you are taking them out and cleaning them very well. So at least once a week, you should be soaking them in some type of solution, which we will show you in a future video, to help kind of soften all of the debris and all of kind of like the gunk that accumulates on them, and help you brush them more easily. Then every day you want to brush it with a little bit of water and soap. And every night you want to make sure that you are taking your dentures out before you go to sleep. It's very bad and dangerous to sleep with your dentures on because it can cause infections, one of those being fungal infections. So let's get to the video on how to clean your dentures. So as we've mentioned before, for those of you who may be using dentures, whether they're complete dentures or partial dentures, complete dentures are just the whole arch, whereas partial dentures are just used to replace like a couple of teeth. All right, so if you have any kinds of dentures, you really want to make sure that you are cleaning them thoroughly, because anything that is in your mouth, even if they're not real teeth, it can accumulate that bacteria. It can cause infections, as we've talked about before. Not only the tartar accumulation, but also just like fungal infections. All right, so you can literally get yeast infections in your mouth if you're not taking out the dentures every night, if you're not cleaning them very well. So we mentioned this product before. This is called Polydent. All right, this is just one brand of the denture tablets. So the purpose of these tablets is just to have something to soak your dentures in. You can do it every night, but if you're doing it at least 3 times a week, soaking them. Now you need to remove your dentures every day, but if you're soaking them in this at least 3 times a week, that would be great. So what you do with this is that you're going to take it out of the packet. All right, and as you can see, it's just a little tablet. It almost looks like a little Alka-Seltzer tab, and it has a very minty, it smells just like toothpaste. All right, so it has a very minty odor to it. It does kill bacteria, as we mentioned before. It kills a lot of the bacteria. 99.9% of the bacteria that causes bad breath. So that's a really good plus side of it. And it makes that tartar, it loosens that tartar so that when you brush your dentures, you don't have to brush as hard. It'll come off a lot easier. So it'll basically just dissolve that hard tartar on your denture. So we're going to take a little tablet, and I have some water here. This is just plain water. When you're doing this, you're probably going to have a bigger container, not a cup, because you want something that your dentures can fit in. It's just that for the purposes of you being able to see how it dissolves in there, I use this cup. All right, so we're just going to throw it in there and let it dissolve. And you see it automatically just starts dissolving, starts bubbling, and you're just going to let it sit there. You can probably go ahead and throw your dentures in there now if you want to, but you can also just wait until it's completely dissolved. Once it's completely dissolved, you can go ahead and throw your dentures in there, and the instructions just say that you just need 3 minutes. So if you just leave it in for about 3 to 5 minutes, then you're fine. So in this one's been sitting there for a longer time. As you can see, it's green. The foam is on the top. Like I said, it smells just like toothpaste. I have a little fake tooth in there. That fake tooth was covered in plaque, like fake plaque. I wanted just to show you how it would be working with your dentures, all right? So I'm gonna take the tooth out. All right, so when you take your dentures out, you're gonna brush them, all right? So like I said, the Polydent or the tablet, whatever type of tablet you use, mostly it's just gonna help loosen that tartar up, but you still have to go back and brush. All right, you can use a regular brush, or you can use their special brushes for dentures that are very rough and big, and so that way you can, it's kind of like for it's a heavy duty brush basically. You wouldn't want to use it on your teeth because it's too rough for your teeth. But this is a regular dental brush, so this is something that's just normal. You can find at any store, and we're gonna see how well it works. As you can see that you can see the white stuff on there. That white stuff was fake tartar that we put. Okay, so we'll see if it comes out. All right, let me go ahead and brush it a little. Just gonna brush. Oh yeah. So you can already see that pieces are just falling off, and this brush, like I said, is just a regular soft brush. If you get a tougher brush, it'll work even better. All right, but I'm just gonna keep brushing a little bit longer. And so once again, you know, there you go. You can see that it did take off quite some of that fake tartar, all right, which is like that whiter, the whiter spots that you can see are the fake tartar, okay? It'll really, if I take my time in there brushing it, it'll really help. I can pretty much pick it off. All right, so that was just to demonstrate how well this stuff works, and why you really want to use it on your dentures, okay? If you start seeing some discoloration on your dentures, it probably is tartar, little tartar buildup that's right there. So like we said, once again, you let the tablet dissolve, put your dentures in there, leave for 3 minutes, and then when you bring it out, you want to brush your denture really well. And you want to rinse your dentures off in water. All right, so before we finish off, we're just going to pretend that this is our denture. Once again, like we said before, you want to get all surfaces of your teeth. You want to get the side that's by your tongue, the side that you can see. You want to get the top of your dentures. All right, some people have those top dentures that basically have like that little roof on top. You want to make sure you're brushing on top, on the bottom, and pretty much everywhere, all the surfaces. Then you can go ahead and rinse them off and you can use them again. All right, thank you.
Thank you guys so much for watching. We hope this video was beneficial for you. As always, remember we do have a post-test questionnaire after this, and if you have any questions, comments, concerns, you can put those in the additional comments section on that page. We do have one more lesson planned to go after this, so stay tuned and have a great day.